Here is some background information on patient education. It is important to choose the materials that will be beneficial for the specific patient. What is helpful for one may not work for all. Making sure the patient will actually be able to learn from the materials chosen. For example, if the patient is illiterate, the nurse wouldn't choose a brochure for education material. They would need to select a new method. Also, being aware of how that patient prefers to learn. Find out what the patient's current knowledge is. The patient may have some knowledge already in how they prefer to do things about their current health, medications, treatment, etc. For example, patients may take 3 medications throughout the day already and have a routine for doing so. If prescribed more medications and the nurse has to educate the patient on these new medications, this will need to be fit into the patient's current routine. Teaching based on the patient's concerns is more important than telling the patient what to do. And it is shown that addressing the patient's fears first is most important, finding out what is worrying them the most. Medical staff should talk through their fears with them and tailor their education to the individual so that it is most beneficial. Their fears may cloud their learning. If a nurse is to choose information that doesn't seem as important to the patient, they're not going to listen when they have fears that are more important to them. Addressing the main concern and talking through and clearing up any misconceptions can be very helpful. Some material often used for education includes one-on-one discussions, brochures or pamphlets, charts and posters, podcasts, videos, television, internet, and group classes. There are so many ways to inform patients. This is why it's important to make sure the methods work best for the specific patient. Who are often the educators for patients? Nurses are a big one throughout the research that I have found. It was found that the nurses were the ones providing the majority of patient education. They are in contact with patients for more time and are able to assess the needs of the patients and better for education. They are the ones that are discharging the patients as well. I found some physicians that do the patient education. I also found a study that students were being incorporated into patient education. There's been research to suggest including medical students in the process of patient education not only improves the quality of care the patient receives, but also improving students' skills, their communication skills with patients, and relationships with patients.